In this presentation, we're going to talk about concussion evaluations. So we're primarily going to focus on sideline or on the field concussion evaluations. First things first, for us to do this, all life-threatening conditions need to be ruled out. So this person needs to have normal airway, breathing, and circulation, no severe bleeding, nor no abnormal sensations or lack of sensations. Pearl, they have to have pearl, which means pupils are equal and react to light. So again, we don't have any life-threatening conditions here. And no need to immediately transport to the hospital. No signs of internal hemorrhaging. So again, before we get to this process, all those things need to be ruled out. So we're not going to do cranial nerve testing. I provided a video on how to test the cranial nerves. There are 12 pairs of nerves from the brain, as you can see in the picture. These nerves provide sensory or motor functions, or both, to our body. And we typically do this when somebody has a head injury. These are included in some of the SCAT tests that we're going to talk about. But again, we're not going to be doing this for our class. But again, I provided a video for you. Typically in preseason, we provide a baseline measurement at the beginning of the season. So we know if somebody has a concussion, we can go back and compare that to the baseline measurement. This can be done on a computer, can be done on apps, or it can be paper-based test, or just a regular evaluation by a healthcare provider. One of these is called an IMPACT, which stands for Immediate Post-Concussion Assessment and Cognitive Testing. Typically done on a computer at the beginning of the season. We'll follow the same thing we're going to talk about with the SCAT-5, Sport Concussion Assessment Tool 5. I have provided the SCAT-5 in class. You should probably have that on the screen with you so you can follow along with this, because the next couple screens are going to be us talking about the SCAT-5. So this is typically used both for preseason and during the on-site evaluation. Just so you know that for the IMPACT and SCAT-5, there are both adult versions and adolescent versions for these tests, just so you're aware of that. So I'm not going to read everything on the SCAT-5 on that first page there, just so you know that what this is, it's a standardized tool used to evaluate concussions. It should be used, again, by physicians or licensed healthcare professionals like me. It should take about 10 minutes. So there's some other information there. Let's go to the next page. So the next page is the immediate on-the-field assessment. So we have somebody who has a concussion. You see some red flags there. So the first thing, just like I said earlier, neck tenderness, neck pain, double vision, weakness, blah, 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 all those red things. If anybody has this, we stop. Okay? We stop this. Okay? So after that, we don't have any of those. The next thing is observable signs. Did you see it? Were you witness to it? Was it witness on the video? So then they have questions there. You just answer yes and no. Line motions on the playing field, yes, no. Balance, gait, what's walking. Motor incoordination, stumbling, slow, labored movement, yes, no. Disorientated, blank, vacant look, facial injuries, head trauma, answer yes, no to any of those. Then step 3 is another assessment tool called Maddox questions. So this is the thing that you tell them. I'm going to ask you a few questions. Please listen carefully and give me your best effort. First, tell me what happened. Mark yes for correct answer. What venue are we at today? Where are we at today? If they can remember where they're at. Can they remember? Yes, no. Which half is it? Or what, if it's not a half, what quarter are we? Where are we in the game? Who scored last in the game? What team did you play last week? Did your team win the last game? You have to know the answer to these questions. So what we're doing here is we're checking memory for everything that happened prior to the injury. Okay, that's checking memory. Step 4, this is called the Glasgow Coma Scale Test. And again, you put some information there, time of assessment, and date of assessment. Okay, so there's a bunch of things there. No eye opening, eyes opening in response to pain, verbal response, best motor response. Okay. And then cervical spine assessment. Does the athlete report that their neck is pain-free at rest? If there's no pain at neck at rest, does the athlete have full range of active pain-free motion? Is limb strength normal? Okay. If a patient, this is at the bottom, if the patient is not lucid or fully conscious, a cervical spine injury could be assumed until proven otherwise. Okay, so that's on the field. That's page 1. Get my fingers to get to the next page here. So now we're off the field. They're in the training room, the athletic training room, or at the doctor's office, and you have all the information there that you fill out on step 1. Then on step 2, if you check to see if this is a baseline or the post-injury test, and then you have the athlete complete that form. Ask them to read out, ask to read this in the instruction paragraphs out loud, then complete the symptom scale for the baseline assessment. The athlete should rate his or her symptoms based on how he or she typically feels. For the post-assessment, the athlete should rate their symptoms at this point in time. So they do all those and give them a score out of the numbers there. And if it's not 100% wide, then you have them hand that back into you. Okay. Now, our next page is step 3, cognitive screening. You ask them, what month is it? What's the date today? What is the day of the week? What year is it? And what time is it right now within an hour? So you give them a score. If they know it, it says 1. If they don't, they get a 0. Then the immediate memory can be completed when using traditional 5-word per trial or using a 10-word per trial. That's a lot. And they give you the 5 words there. You tell them in the little blue letters you can't see on the screen, but on your thing, it says, I'm going to test your memory. I will read you a list of words, and when I'm done, repeat back as many words as you can remember in any order. For trials 2 and 3, I'm going to repeat the same list again. Repeat back as many words as you can remember in any order, even if you said the word before. So, for example, A, finger, penny, blanket, lemon, insect. And then they cite it back. Okay, so they do go through that. Again, there's more information on page 7 of the SCAT 5 to give you more information. Then there's a alternative 10-word list. If they can do 10, they're doing pretty good. So next one is concentration. This is one he says, I'm going to read a string of numbers, and when I'm done, you will repeat them back to me in reverse order of how I read them to you. For example, if I said 719, you would say 917. And so they give you a list of a bunch of numbers there on the sheet and see how they scored. Again, if you look on page 7 of the SCAT directions, they give you more information about that. Then you ask them to now tell me the months of the year in reverse order. Start with the last month and go backwards. So you'll say December, November, and then they go ahead and do that. So how they do. Next is neurological screen. So it says see directions on page 7, which I have handed out to you. Can the patient read aloud symptoms checklist, follow instructions without difficulty? Does the patient have full range passive spine? And you can read all those. Then you have balance testing there, double leg stance, single leg stance, tandem stance. Then step 5 is delayed recall. You do this 5 minutes. So you tell them, I want you to remember these numbers. Okay, I usually have a set numbers 3, 6, 18. And you tell them, I want you to read those numbers. And in a couple minutes, I'm going to have you remember those numbers. And you do that a couple times. Because what we're trying to see is if they can recall stuff later. And then number 6, step 6 is decision. You fill out all that information and how well did they do, and then you make a determination if they should be returned to play. And as you can see in big bold there, it says scoring on the SCAT-5 should not be used as a standalone method to diagnose concussion, measure recovery, or make decisions about the athlete's readiness to return to competition after a concussion. Why is that there? It's because there should be multiple ways that we determine if somebody should return to play. That goes back to this consensus statement on return to play, as we talked about in the head injury presentation. It's got to be a gradual return to play following these 9 steps. The step we're at is step 1. Okay, and they have to go through all these different steps before they can return to play. They have to be pain-free or symptoms-free for 24 to 48 hours for each one of these steps before they can return to play with unrestricted, normal return to play. Again, this is just a quick and dirty on-the-field concussion evaluation. If we were doing this in class, in person, I would have you pair up into groups, and you would each practice doing a SCAT-5 on one another. So if you want to do that, go find a friend and have them, you do the SCAT-5 on them.